Um, Jennifer, could I nominate you as timekeeper? Just to note that in the chat every so often.
Yes, I can do that.
Amazing.
I was also planning on watching the time.
Thanks, Shannon.
Of course.
Oh yeah, I'm remembering you had some very good keeping us on time last year.
Thank you. Welcome. We're so glad to have you join us this afternoon or this morning. My goodness, it's morning here. But we are recording this, so it could be any time of day when you may be rewatching this. My name is Shannon Buckmaster. I am the Community Prevention and Wellness Fund Development Director here at Yamhill Community Care, also known as YCCO. Today we'll be talking about our 2025 Spring RFP, both the project focus for the RFP and the application process. We have an amazing YCCO team that I will introduce shortly. Before we go into the content of the program, I do want to get started with some housekeeping rules or guidelines. First of all, you'll be muted during the meeting by default to minimize background noise. Please remain muted unless you are speaking. The session will be recorded and will be posted on our website, yamhillcco.org. Thank you for consenting to recording by participating in this webinar. If you experience technical difficulties, please send a chat message to Natalie Walker or Patricia Wright. They are our administrative assistants for this session, and they should be able to help you. We also have translation services in Spanish provided by Ariel, correct? Excellent.
Yes.
Perfect. Thank you. Natalie or Emily Johnson can help with translation access. And let's see, you may also use the chat feature for questions or comments. We'll have two designated question and answer segments in the program. So one will be based on the sources of funding for the RFP, and then a later Q&A session will be on the application process. We will have, since we'll have dedicated time for questions, please hold questions until we've explained the application process and discussed the specific funding programs. You can mark your questions in the chat so we don't lose that. But again, know that we'll have designated Q&A times. Please use the raise hand feature for asking to speak. This helps manage the flow of the conversation and ensures that the discussion is orderly and everybody gets a chance to speak. This webinar does not address our request for proposals RFP for Community Capacity Building Fund, CCBF. That is a separate application process opening on April 1st with different program requirements that will be addressed in a webinar on March 20th. So this webinar is only for the 4 funding sources that we'll be discussing during this session. This webinar is designed to address general questions about the application process and not for discussing details of specific projects. Please email funding@yamhillcco.org with project-specific questions, and we can put that email address in the chat as well as a link to our website. We offer one-on-one technical assistance, and please remember, we still have limitations on our support so that we can be fair to all applicants. We will generally address the strengths of projects and our expectations for the application process. For the question and answer session, please have your video on if possible if you're asking a question to foster a more engaging and interactive environment. We also understand if somebody needs to keep their video off due to bandwidth issues or personal preference, and it won't affect your application outcome. Please also consider the importance of maintaining respect toward all opinions and questions during the webinar. This creates a safe and welcoming environment for all participants. And this webinar recording will be posted on our website, as I mentioned, along with the RFP, the request for proposals, the slide presentation from today in English and in Spanish, and a frequently asked questions tool as generated by this session. So we'll use some of your questions to create that guide, and all of that will be posted on our website. Now that housekeeping is taken care of, I'm pleased to introduce the amazing team that we have facilitating this conversation today. We have Natalie Walker, our office manager, Patricia Wright, our administrative assistant, Jennifer De Leon Cossey, our public relations specialist. We also have Olivia Williams, who is our community prevention and wellness coordinator at Yamhill County Public Health. Danielle Russell is our grant program manager. Emily Johnson is our community health program manager. Shanna Moon is our community program specialist. And Hope Caldwell is our traditional health worker liaison. The primary presentation will be myself, Emily, Shanna, and Hope, as we stay very closely, or we work very closely with the four sources of funding that we're discussing this afternoon. So you have the funding experts in the room, the virtual room, with you today. All right, now that we've checked all of those boxes off, I'm going to turn it over to Emily to explain access for translation services.
Okay, if there's anyone here who needs Spanish, you can click on the interpretation globe at the bottom of your screen and hit Spanish. And I'm going to pass
Si
it to
alguien
Ariel. So
aquí, si alguien necesita interpretación en español, pueden hacer clic en el globo que dice interpretación en su pantalla
please also put your email address in the chat and we will email you a Spanish version of these slides.
y también pueden poner su correo electrónico en el chat y nosotros le vamos a enviar el webinar en
It
español.
won't show my video, like it won't show me. They're requesting.
Okay. All right, I will go ahead and turn interpretation on, and please feel free to join that Spanish room if you would like.
Ya va a estar funcionando la interpretación.
Thanks all.
Excellent, thank you. And thank you, Ariel, for joining us today.
Thank you.
So here's the outline for our webinar today. As I mentioned, this is going to occur in two parts. Part one will be an overview of Yamhill Community Care's joint funding Spring 2025 RFP. And again, that's request for proposals. We try to unpack the jargon and the acronyms. We will cover the timeline, eligibility for our applicants, project requirements, our different funding streams. And as I mentioned, we have 4 funding streams included in this RFP. And then we'll have a question and answer section. For part 2, we'll cover the application details. So we'll be discussing or explaining our evaluation criteria, including weighted categories and details for evaluation. We'll discuss outcome measures and give examples of what we would consider strong outcome measures for an application. We are so thrilled to debut a new grant management software platform that we are engaging with this year. It's Foundant. So we are going to cover basics of how to register for your account and how to submit an application through our online portal. We'll also discuss how our review committee is assembled and an invitation to participate. And then we'll have our final question and answer period. The timeline that we're working on. Today, February 19th, we have our technical assistance webinar, a TA webinar, and that is being recorded and posted. On March 3rd, 2025, our RFP will be released. It will be live. There will be a link to an RFP on our website, and you'll be able to access the RFP on our Foundant website. The application will be open from March 3rd through April 11th. We will offer technical assistance up until 5 p.m. on Friday, April 11th. So there is a deadline there. However, the applications are not due until 11:59 p.m. on Friday, April 11th. Between April 12th and May 2nd, our grant review committee will review and score applications. From May 2nd through June 17th, our governance committees will review the applications, and that does include the YCCO Board of Directors making our final awarding decision. We will announce awards by June 18th, and our goal is to have all contracts executed by July 31st. I do also want to mention there's one more date in there, and we'll cover it later. On February 24th, our Foundant website will be active, and people can register their organization. So if you want to get some of the administrative work done before the RFP opens on March 3rd, you'll have an opportunity to do so beginning February 24th. All right, Emily Johnson is going to take over the next section of information.
Okay, so we will dive right into the eligibility and the funding requirements, get some of those requirements that are applicable to all funding streams out of the way before we talk about some of the individual funding streams. So if you would like to apply for any of the YCCO grants in the RFP opening in March, applicants must be 501c3 nonprofits, tribes, public or governmental agencies. And if you are working with a collaborative, we really encourage that. We love to see collaborative projects, but there must be a single applicant or a fiscal sponsor. The Foundant platform will really only allow one single applicant, but you may collaborate with other partners. We cannot award funding to individuals. We can't award for political purposes. So that would include things like lobbying for an individual candidate. We also cannot create awards that will disperse subgrants. We do allow subcontracts, but an awardee cannot take that funding and then go through their own grant process to disperse those subgrants. We are a 501c3 and so cannot award funding outside of the requirements of charitable purposes under the 501c3 corporation limitations. Organizations cannot apply to supplant existing funding streams. So we can provide funding for project continuation or expansion, but we can't displace current funding, so you can put that funding elsewhere. We also cannot award to agencies that have current outstanding contractual items. So that means if your agency has an existing grant agreement with us or an existing contract with us that is not in good standing. So if you haven't submitted reports, have a late report, are missing some element of that agreement currently, you would not be eligible for new grant funding. We really wanted to clarify this year that we will generally only be awarding to one organization per cycle. So organizations are certainly welcome to submit multiple applications for multiple projects, but we will only be awarding one award per organization. And that's really because we've seen such an increase in applicants that in order to be equitable, we want to ensure that multiple organizations have the opportunity to be awarded. And then finally, none of our grants can be used for healthcare service delivery. So this would be any type of Medicaid covered benefit that is currently covered and could be billed or is able to be billed. And so if there is a staff member delivering a service like vaccines, even if those services are not being billed, you're going out and not asking for insurance, those services are anonymous, that would still be a service that could be covered by Medicaid. And so we are unable to fund those services. This year, Medicaid covered services also can include something called health-related social needs. If you come to the webinar on March 20th, you can learn more about that. But for the purposes of this grant funding, one of the new Medicaid benefits is actually covering things like housing, nutrition, and climate devices for individuals. And so if you would like to apply for a program that offers things like rent and utility supports, things like meal delivery services, you're not disqualified from this funding, but there will be an element of ensuring that that service will not supplant the existing Medicaid benefit that does cover those types of services. So this will be a theme throughout this webinar, but we really, really encourage people to reach out for individual technical assistance. We can talk through some of the nuances of health-related social needs benefits and determine how much overlap your project may or may not have with Medicaid service delivery. Okay, next slide. Another project requirement, much less complex, we ask that any projects align with YCCO's vision and mission. which is a unified, healthy community that celebrates physical, mental, emotional, spiritual, and social well-being. And our mission is to improve the quality of life and health of the communities we serve. I imagine all the agencies here have missions and visions that are pretty aligned with that, but that is one of our requirements. Next slide. So another requirement is that a project must demonstrate a real need and an understanding of the populations that they're serving and how those needs may differ between those populations. So we've listed a couple of populations that tend to be underrepresented or underserved. This is not an exhaustive list. You are welcome to reach out to us and say, hey, I'm looking to serve this population. What we really want to see is that there is an understanding of demonstrated need for that specific population. So that might be understanding the demographics of the community you're serving. It might be understanding how specific individuals or specific types of demographics may experience that need in a different way, and that you have a way to meet that need according to those individuals or that population. Okay, next slide. All right, and I will pass it on to Shanna for us to jump into talking about the CHIP and then the CHIP specific projects.
Thank you, Emily. Good morning, everyone. I'm Shanna Moon, and I will start off with sharing a big picture look at how this funding connects to our Community Health Improvement Plan, or CHIP. The CHIP is a collaborative effort between YCCO, Yamhill County Public Health, and Providence Newburgh Hospital. It was created based on a deep dive into community health needs, really looking at where people are experiencing health and equity disparities and identifying ways that we can close those gaps. And from that, a strategic plan was developed to guide the work being done across the county. And on the screen, you'll see the 7 focus areas that the CHIP is built around. Each of these has specific goals and strategies that help guide decision-making at the CCO, including how we prioritize funding. This means that projects that clearly align with these goals tend to be more competitive when it comes to those funding decisions. So in a nutshell, if you're applying for funding through this RFP, your project must align with the goals and strategies outlined in the CHIP, or Community Health Improvement Plan. To make that easier, I've linked the full CHIP document in the chat, and it's also linked throughout the RFP. So you really can't miss it. And if you don't see it in either of those places, please reach out and we will be happy to send it to you. We highly encourage you to take some time to review it so that you can see how your work fits into the bigger picture of what we're prioritizing this year. And next, you can go to the next slide. We'll cover the different funding streams included in this year's RFP, starting with the CHIP grants. So this particular grant, the Community Health Improvement Plan, or CHIP grant, is overseen by our Community Advisory Council, or CAC. The CAC is one of YCCO's 2 governance bodies, and it's made up of community stakeholders with at least 50% of members being Oregon Health Plan recipients. Beyond overseeing this grant, the CAC is also responsible for the community health assessment and the development of the CHIP, which we just went over in the prior slide. Their role here is to evaluate and select projects that closely align with the CHIP's specific goals and strategies, while also making sure funding is directed toward the key priorities they've identified for this year. For this funding cycle, the CAC is prioritizing projects that focus on youth and elder populations, housing initiatives, nutrition programs, and mental health supports. On average, these grants tend to be around $20,000 per project. So some may be a little higher or lower depending on the scope of the project. And in total, there's $100,000 available in funding for this grant cycle under this funding stream. Next slide. And I will turn it over to Hope Caldwell, who is our traditional health worker liaison, to talk about the THW grant opportunity.
Hi, everyone. My name is Hope Caldwell. I'm the Traditional Health Worker Liaison at YCCO. And the second funding stream is the Traditional Health Worker Grant. It prioritizes training, mentorship, and support for THWs. Past awards have been between $4,000 and $15,000. And I'm going to pass it on to Emily.
Okay, our third funding stream. And I think we mentioned this, but I do want to pause and note that this year we are not asking applicants to identify which funding stream they think they qualify for. You are certainly welcome to indicate that in the narrative of your application, but we will do that work on the back end, and applicants can apply based on this overall criteria, and then we will appropriately direct that application to the funding stream or streams that it best fits. So this is helpful information and not information that you need to feel like you have to be an expert in. Okay, so SHARE is the one grant that we have that does allow capital expenses. That's kind of the thing that sets it apart. It tends to be one of our larger funding opportunities. Past awards have ranged from somewhere around 60,000 to 250K, with some fluctuation plus or minus on either side. SHARE grants are specific to the social determinants of health and equity. So those are economic stability, education access and quality, neighborhood and built environment, and social and community context. So any programs that are really speaking to those social factors that may impact individuals' health can be eligible for SHARE. In 2025, there's also some additional flexibility to support programs around access to healthcare and quality as a SHARE domain. So again, it cannot be healthcare service delivery, but programs that support individuals' access to or navigation within the health system, including traditional health worker supports, could be qualified for SHARE funding. That said, the priorities for SHARE funding per YCCO this year are housing, nutrition, transportation, and climate. So past awards have leaned a little heavily towards those capital expenses because this is the only opportunity we really have to cover capital expenses. So transitional housing builds, different kinds of supportive or affordable or permanent housing builds have been funded with SHARE, as well as things like van purchases, food pantry remodeling, community center development, all of those types of things. We have supported non-capital projects, and that is not one of the criteria that we have. So a capital project would not necessarily be more competitive than a non-capital project. Okay, next slide. So capital expenditures, for those who don't know, this is something I learned as an adult, are funds that are used to acquire, upgrade, and maintain physical assets. So these are not things like, buying paper or supplies for a cooking class. Capital expenditures are going to be those more permanent investments. So things like builds, repairs, if it extends the useful life of that thing being repaired, like a roof, Purchasing new equipment, so like a refrigerator or building an entirely new facility. There's lots of resources on the internet about capital expenditures and what counts and what doesn't count. Okay, next slide. Oh, and then I will go ahead and pass it to Shannon.
Yes. Again, my name is Shannon Buckmaster. I'm the Wellness Fund Development Director for the Community Prevention and Wellness Fund at Yamhill Community Care. I'm thrilled to talk about the funding opportunity that we have through the Community Prevention and Wellness Fund. So our priorities for the CPW Fund, we really focus heavily on evidence and research-based primary prevention strategies. And I do want to clarify evidence and research based. That does not need to be research done by your own organization. You are welcome to justify your project with research or evidence from another institution like a university, a college, a research center, a medical facility. And so it doesn't have to be specific to your organization. For our average past awards have averaged $100,000 per project. So this is the funding opportunity where perhaps you can be a little more aspirational. I will say that our total award available for CPW funds in this RFP this year is $500,000. So we encourage you to think strategically about your project ask. We have identified as a CPW committee that we have 4 priorities for funding investments in 2025 and 2026. Those 4 areas for investments are social emotional learning programs, which include suicide prevention programs, and SEL programs that can be pre-kindergarten, that can be grade levels K through 12. We are focusing on a younger population for these programs, including the suicide prevention program. So it's youth focused. We also prioritize early childhood programs. That does include perinatal or perimaternal services, doula services, support, parenting classes, home visiting services. So really thinking about supporting families with the youngest children. That also includes early literacy and other social supports for families and new parents. We're also prioritizing nutrition, and I know you've heard nutrition mentioned with the CHIP grant as well. One of the reasons why we have this single entry RFP application process is so that we can do the evaluation for where these programs are best matched sometimes. And then we are also focusing on workforce development, specifically childcare workforce development, both in creation of childcare workforce and in creation of new childcare spots within our service community of Yamhill County. And we also serve portions of Washington and Polk County. And if you have questions about service areas and how that affects eligibility, our staff can answer that as well. So what does evidence-based mean? An evidence-based initiative is one that demonstrates a noticeable effect on improving outcomes through strong evidence. Again, this does not have to be research that you have done as an organization. You can rely on strong academic and research and medical partners. We have found that the best evidence-based programs do have strong connections to interventions, proven programs, and either policy recommendations or policy implementation at a regional, state, or federal, national level as well. What is primary prevention? Primary prevention refers to actions aimed at avoiding the manifestation of disease or preventing negative health outcomes. This may include actions to improve health through changing those SDOHE markers, social determinants of health and equity. It may include the provision, or it may include information on behavioral and medical health risks, as well as solutions for avoiding them or preventing those negative health outcomes. Another way to think about this, or another phrase that you may be more familiar with, the CPW funding initiatives attempt to move upstream in the projects that they invest in. So to get ahead of the problem before the problem manifests. And you can see there's a simple diagram. Primary prevention is avoiding negative health outcome and removing risk factors. Secondary prevention while it's closely related to primary, it's really where we start to identify some of those challenges as they're happening and try to course correct. And then we have the tertiary or intervention practices where we are already recognizing negative health outcomes and again trying to course correct or trying to prevent some of those negative outcomes from being transferred intergenerationally. So one of the reasons why we focus so heavily on young families, young people, is because that's really our window of opportunity to have the greatest impact downstream. All right, so now we'll open it up to our first question and answer period. Again, these are questions that you may have specific to any of the 4 sources of funding that we've presented on. If you would like to raise your hand to ask your question live, you're certainly welcome to do that. I see that we have, I think, just one question in the chat, so we can start with that. Rachel King asks, can CHIP funds be used for capital improvements or only share? Emily did answer share is the only fund allowing capital expense, which is really why, you know, it's kind of a special component of our funding opportunities. Are there additional questions? Right. Again, we will have a final question and answer period. So if you have questions at the very end of our webinar, including questions about our funding streams that you think about during the next section, we can come back to any questions that you have. All right. So let's begin our conversation about what the application process entails.
Okay, I think on the next slide, we will talk through our application sections, the weighting and scoring, and oh, I'm so sorry. I'm seeing a note about interpretation here.
I can
I'll
step
give
in.
you. Okay.
Yeah. So during the next section, we'll talk about the different elements of the application, the sections, and what our expectations are for strong or competitive applications based on the types of information or responses we're requesting. We will talk about how to determine project alignment. We will cover what our application sections and weighting process are, and give some finer points on application quality, sustainability, outcome measures, and give a few examples of that. All right, back to you, Emily.
Okay, I think we've resolved it.
Okay, great.
All right. So we are scoring each application. As Shannon shared at the beginning, we will be running each application through a scoring process that's made up of a scoring committee that is reviewed for any sort of conflicts of interest. They will score each application with an objective scoring rubric. Those scores will then be passed on to committees for discussion and review, and then all applications that are recommended receive final approval from the YCCO Board of Directors. The weighting within these scores is based on community feedback and staff discussion of what's really important to align with YCCO mission and vision and values. So the application quality, you'll note, is weighted a little bit less. And this is intentional to be equitable to those organizations that may not have a professional grant writer or have a ton of experience writing grants, but have a very clearly demonstrated need and a good plan to address that need. And so we do consider application quality as very important, but it is weighted less than the value and the impact of the program that's being proposed. So the other areas that we review for are sustainability. Is there a plan to continue the impact of the project or program? What is the impact? Is the change from the beginning to the end of the program significant? Is it serving either a large number of people or a smaller number of people who have a higher need and may see that greater impact, like a group of particularly high-risk children, for example? Um, and then the greatest weight is applied to the population served. So those are some of those demographics. Is there a high need? Is there a demonstration of some sort of disparity being experienced by the population served by the program? And is there alignment with YCCO vision and mission? Is there CHIP alignment? And does the project align with one of our funding streams and the limitations that those funding streams have? Okay, next. So the application quality is going to include some basics. Did you complete the application? Is every question answered adequately? Is it written clearly in a way that is easy to understand? Shanna is going to talk a little later about Foundant, which is our new grant management platform. This is also going to make it a lot easier to score well on the application quality section because it does not let you submit if you haven't answered each of the questions and included specific outcome measures where we ask for them. So these are the kind of basics around what activities are being proposed. Are there outcomes? Are they written using SMART goal structure, which I will talk about? Is there a realistic and clear plan? And is there a need? This isn't necessarily going to speak to the kind of content, but more the presence and the way the application is written. Okay, next slide. So the sustainability plan is a really key piece that I think a lot of organizations can get really nervous about, especially organizations that are largely grant funded. So, oh yeah, if you'll click again. Strategies for sustainability do not have to be that you have a lot of money coming in and you have a guarantee of a way to continue your program, but we do want to see that there is a plan. So this plan, we don't love to see that the plan is YCCO will fund this program forever, or even we'll look for more grant funding. That doesn't necessarily show that a lot of thought has been put into the sustainability of the project or program itself in creative ways. So this might be a demonstration of collaboration or integrated resources, any sort of resource sharing or partnership that may make it more likely that this project or program may continue. It may be that this is a capital project and there is a big initial investment. And after that, it will be maintenance funds that if an organization can demonstrate they can provide, that would be evidence of sustainability. This may also include things like demonstrating that there are diversified funding sources being explored. So maybe it's grants and donations. Maybe it's another type of investment or payment system to continue the program with participants who can pay. There are all kinds of options for exploring what sustainability will look like, and we're going to score on the evidence that there is a plan and that there's an effort made to make sure that the program continues, regardless of the kind of fluctuating funding streams that a lot of us are really subject to. Okay. So I'm going to spend kind of a while talking about outcome measures. Outcome measures in grant applications for YCCO are the elements that are going to follow an applicant into their award, into their contract, and through to their reporting. So the outcome measures that are submitted in an application need to be outcome measures that we would feel comfortable holding an organization to, and that we also think will be reasonable ways of reporting progress on that project. So I will talk a little about outcome measures and how to build a strong competitive outcome measure. So they need to be variables, things that can change over time and can be assessed for program success or progress. They're really used to evaluate whether the goal that you set out to accomplish, the need that you set out to meet, actually was met or accomplished. And so strong applications that are going to score high will have projects with a significant, measurable, positive impact on the identified need. Next slide. So in order to create an outcome measure, I know some of this may be redundant for some of you, some of this may be really new. There need to be clear and specific goals, indicators of success, and the appropriate metrics. So identifying where you are, where you would like to get to, what success looks like, and then what could you measure to be able to follow and demonstrate that success. So on the next slide, these are SMART objectives. So we love to see SMART objectives in each of the outcome measures in the application. When you fill out the application, there are actually going to be 3 separate boxes for you to place 3 minimum outcome measures, and following this SMART tool is going to make sure that you have all the components that we look for in an outcome measure. It needs to be specific, who and what is going to happen really specifically, measurable. That might be how many, it might be how often, it might be to what degree, it might be we complete one task. Achievable, we do generally award year-long grants. We have in the past awarded multi-year grants, but in general, we like to see that a project can be completed in that relatively short time span. Relevant, there's a real present need that this project is addressing, and time-bound, that whatever is happening has a timeline and that we can really see what is going to be completed when. Again, that's just a demonstration that there has been thought put into this project and that there's a clear plan for completing it. So I will jump into a few examples. It looks like we're doing fine on time. So thanks, Shannon. An example might be, our program will reduce homelessness in our community by 5% in 1 year. This is telling us something about the project, but is not showing the amount of detail that goes into understanding that that project meets these SMART goals, that it's really specific, it's measurable. We can tell exactly what you're going to do and what you will be able to report on. So a better example might be, by the end of 12 months, our program will reduce homelessness in our community by 5%. That is a lofty goal. By providing stable housing and wraparound support services to at least 50 individuals, tracking progress through monthly outreach reports and shelter data. That's a lot of components for a single outcome, but it is really demonstrating all of the elements that an individual or an organization would need to report on to show success. So it's really specific. We know what is going to happen. We know what is going to change and by how much. It has a concrete number of individuals. I think reaching 50 individuals is a reasonable goal for a single year. It aligns with a need that we've identified in the community. Another key piece of this is this aligns with our community health improvement plan, and many of our funding priorities include housing. And finally, it is time-bound. It clearly states a 12-month time frame, and presumably there is a timeline to indicate what happens when to make sure that goal is achieved. Okay, example 2. So 50 adult patients are going to enroll in a platform and will get a booklet so they can learn. That tells us what's happening, but doesn't have a ton of detail. you can just do the rest of the slide, Shannon. So in more detail, we look for that timeline. We look for the number of participants. Uh-oh. Here, I'll jump into mine. Thank you. Amazing. We'll look for how it's going to be tracked and what tools are going to be used to track it and what is being assessed. One of the biggest things about this first measure written is that we don't know what will be assessed or what will change. If people are enrolling in a learning platform, we can make an assumption that we want them to learn, but how are we going to measure that that learning has happened? And what are the process and outcome measures that are used to determine that success? So having that kind of focus on lymphedema education and a really clear target and engagement also can show us how from baseline something has changed in a positive way. Okay, last one. You can pull up the whole thing again. We could look at literacy rates. We again want to look for that specificity, that timeline, having those benchmarks. I'll impress again that writing outcome measures needs to be something that you feel able to report on. And we offer a lot of technical assistance in reporting. We do site visits with our awardees and talk through the reporting measures. This can be a really iterative, collaborative process. But if you're looking to measure something and you don't have a realistic way of doing it, pick a measure that is hopefully more realistic and that you do have the tools to measure. We do a lot of projects where we say, sure, we're going to survey 500 people about their experience. And in many cases, with some of the participation that we see, that's really not realistic. And so we would rather have outcome measures that are realistic and achievable than those that maybe look really good on paper or are using tools that you may or may not have access to. Okay, those were outcome measures. There are a lot of really nice resources about SMART goals. We actually, as an organization, use something called SMARTY goals, which add inclusive and equitable. So was the population who is going to be served involved in the process of developing this application or these goals? Do you understand the population served, and are you seeking to reduce disparities with the project? That's not something that we really formally review, but looking at SMARTY, IE goals, as a way to frame your outcome measures may be a helpful way to think about some of those other elements we're asking about, like population served and demographics. All right, the next pieces of the application, building a plan. I mentioned a timeline. Once you've built your outcome measures, it's pretty likely that you're going to have the beginnings of a timeline. So what is going to happen? When will it start? And when will it end? This is in one way really helpful for us because if an organization is proposing a project that won't start until 2027, and we don't learn that until we've written a contract, we have to create some major changes in that project scope for that organization. And so for us to understand when things will start, when they will finish, really allows us to understand which funding stream and which form of funding could be most helpful to that organization. Okay, next slide. I talked a little about this already, so I won't spend a ton of time, but projects must serve people in Yamhill, Washington, and/or Polk counties. That is the service area of YCCO, and so our grant funding is limited to those counties. We do encourage people from all three of those counties to apply. The population may include identification of one or more populations that might be underrepresented. There was an earlier slide that had that list. at least 50% of the population served must be low income or on Oregon Health Plan. There are a couple of ways of determining that. It doesn't have to be completely precise, especially if this is a program where you're bringing in participants. We would just look for a demonstration that you are advertising to low-income participants, reaching out to YCCO members, OHP members, etc. We really like to see that the people who are impacted by this project are also included in its development. So if a housing unit was going to be built, that there's been outreach to understand whether single family versus multi-generational housing is more important to the community. We want to see data has been used in making decisions about the program implementation. We love to see clients or participants on committees or boards to plan the work that is happening and to advise it. And then any sort of ability to collect information on project participants by demographic. This is something that we ask for reporting on around demographics, and we understand how complex and sometimes how fraught collecting demographic information can be. And so we work with organizations who tell us people are really scared to share certain information about themselves, or this feels really personal and uncomfortable. We would lose membership if we gather this type of information. And so we really understand that if you can't share the specific demographics, so that might be race, ethnicity, age, language, disability, sexual orientation, gender identity, we have a very clear understanding that sometimes that information is really complex to acquire. And so it is not a requirement that applicants or awardees do collect this information at a granular level. We do ask that there is an understanding of the population served. So if that's a proxy, you're using our community health assessment, you're using school district report cards. There are lots of sources of data to help understand demographics. And so we ask that applicants really take the time to find the information that is out there and have an understanding of what they have the capacity and ability to collect. Okay, I think we're almost done. So alignment, we are going to score on how projects align with our vision, mission, and funding priorities, how the goal is going to serve the goals of YCCO and the goals of these funding streams to meaningfully improve the health and well-being of the community and promote a partnership. Like I said, we really see these grants as partnerships, and we want to work closely with both applicants and awardees and even organizations who are not awarded to see how we can better partner, share resources, and connect and communicate in a more productive way. Okay, I will pass it to Shanna to talk about our fancy new grant management platform.
Thank you, Emily, and thank you for taking us through all of that very thorough instruction. We appreciate you. As Emily said, we're getting fancy. This year, we're making a big shift in how we manage our grant applications. In the past, most of our process was manual, but with multiple funding streams, each with some overlapping and some with different priorities, we needed a system that could keep everything organized and make things smoother for our applicants as well as our team. So we are excited to introduce GLM, or Grant Lifecycle Manager, by a company called Foundant. This platform will help streamline the application process, making it easier for you to track your application, save your progress, and get consistent support from start to finish. Some of you may have used GLM before, while for others, it might be totally new. Over the past several months, our team has been working hard behind the scenes to integrate all of the different elements of our funding process into the platform. And we are now in the final stages of getting everything set up. And we want to give you just a quick introduction so you have some idea of what to expect and get an initial level of familiarity with how the site will look. So over the next few slides, I'll show just the initial steps like creating an account and logging in so you can get familiar with how it all works. And then I'll show you a sample page that our team has been using to practice to give you an idea of what you'll see when it comes time for you to apply. So the first page that you're seeing now, yep, is the login page. And this is what you'll see when you click the link we will be posting on our website on the 24th, as Shannon said earlier. If you already have an account, great. You can just log in using your same credentials. But if you're new to the system, you'll need to create a new account. Down there, next to the right of the log on button, you can see create new account. And that will take you to the next page on the next slide, where you will enter your organization's information and set up your login credentials. One important step in this process, all of them are important, but this step is essential because you can't move forward without it, is to make sure that after you enter in all your information, you need to check your email to confirm your registration before trying to log in, or it will not let you log in. Once you're in, you can go to the next slide. Once you're in, you'll land on a page that looks a lot like this. As I said, this was a practice application that our staff was using to test things, and that's why it says silly things like Scooby-Doo's house. Yours will not say that, nor will it have sandbox in the background. As I said, that's just our test version. Your page will have our logo and our branding colors, and so you will know you're in the right place. And right in the center of the page, you'll see a link to the application. So when you hover over it, it will become a hyperlink, and when you click it, it'll take you straight to the form on the next slide. The layout is pretty simple. All your organization's details, which you entered in when you registered for the platform, will show up at the top. And then on down, you'll see drop downs for each section of the application. So it should be pretty simple. I'm going to post right now a link to an applicant tutorial, which anybody can access. You don't have to be part of the platform yet to access this, but it will take you through all of these steps in more detail. It also has a video if that's your preferred way of learning. So the RFP opens officially on March 3rd, meaning you can start filling out and submitting your application on that date. But before that, we will have a downloadable version of the RFP and application on the website. Plus a read-only version will be available inside this platform on February 24th. And a heads up that only applications submitted through this platform will be considered for funding. So please make sure to use this system when you are ready to apply. And as always, if you have any questions, we're here to help. You can reach out to funding at yamhillcco.org. And all of us on this call here have access to that inbox, so someone will respond ASAP. Next slide. Okay, and so as part of our commitment to transparency, equity, and objectivity in the funding process, we are incorporating a layer of community involvement within our review process again this year, second time. So in addition to our usual review committees like the Community Advisory Council and our Board of Directors, we are adding an external review committee made up of community members with lived experience in Yamhill County. These members will help bring valuable perspectives from those who live, work, and engage in this community every day. And we are currently recruiting community members to serve on this committee, and we would love your help in spreading the word. Members will be compensated for their time and will be responsible for reviewing up to 6 applications between April 12th and May 2nd. That's the review period. And all reviews must be completed by 11:59 p.m. on May 2nd. As a quick note, if you are applying for funding in this year's funding cycle, you're not eligible to serve on the committee because that would introduce a conflict of interest. But if your organization decides not to apply, or if you know somebody who would be a good fit for this role, please send them our way. It's a good opportunity to be part of the funding process, learn more about community initiatives, and gain insight into local funding priorities. Please just scan the QR code on the slide, and that will take you to more details on the time commitment, compensation, and how to apply to this committee. And that is all I have to say about that. So passing it back to all of us and everyone on the call for Q&A number 2.
Excellent. Well, thank you so much. And we know this is a lot of information, which is why we provide significant supplemental materials. Our team is available to support you. It's really our goal to make sure that these funds are in the community doing the greatest amount of good in the next year. Which brings us to one question that came in the chat. It was from Megan Cornelius, and Megan asked, is the 12-month time frame July 25 through July 26? Generally speaking, it's 12 months from the execution of the contract. So it would typically run July through June 30th when we have our final reports available, but we are open to communication. Emily or Shanna, would you add anything to that answer?
No, our deadline for awardees to sign contracts is generally in July. And so we might see contracts from August to July or from July to June, but that would be the typical time frame.
I will clarify, we cannot dispense funds until the contract is signed and returned to our organization. So if you're thrilled to be funded, of course you would be, and thrilled to start your work with funding, getting that contract taken care of sooner it's a great idea. Are there any other questions? And as a reminder, you can raise your hand and unmute, or you can type questions into the chat. And we can also answer any questions that you may have about our 4 funding streams from the first portion of our webinar. Carlos, yes.
Hi, thank you so much for putting this on. It's been really, really helpful so far. I had one quick question about kind of um, creating like a competitive ask amount wise, like ask amount, since we're not necessarily responsible for orienting our ask within a specific funding stream, but they all have different grant amounts, like kind of average sizes for grant amounts. How do you kind of recommend we approach that, since we might be asking for, different projects that are different amounts, but if it comes from different funding streams and it's only a certain amount available. I don't know if I'm making that clear or not.
If I understand that correctly, you're asking how we might restrict, match, or braid funds between the different funding sources for projects that are qualified to receive funding. We have in the past looked at projects with that braided or matched fund process between different funding sources. So if a fund has more available money, we may fund 80% of a project through that particular funding source, and then supplement with 20% from another funding source that is also aligned with those priorities. What we have seen in recent years, some of our most competitive projects will focus on those grant priorities for the different sources of funding. So they will typically self-identify as applying to share funds or applying to CHIP funds or applying to CHW, THW funds. If by chance you have that process and it's not closely aligned with the fund that you have self-identified, we can have that conversation as a staff internally, and we may find that it's qualified for a different source of funding. And so we could reach out during that. Again, our goal is to support successful implementation of these funds in the community. And we understand there are a lot of restrictions, a lot of regulations, differences between the types of funding. It's our job as staff to manage those complications, and to support you in that process. I would encourage you to consider those total funds available as we had shared for many of the opportunities, and also the average award amounts for the types of funding. So knowing that there may be $50,000 total in community health worker, traditional health worker grants, it's not competitive to ask for $80,000 in funding from that particular funding source. So consider the limitations as well. Carlos, did that answer your question? Or Emily or Shanna or Hope, would you like to contribute anything with that?
That definitely answered my question. Thank you so much.
All right. And it looks like we have a couple other questions in the chat. Thank you for the feedback, Sonia. Julie writes, our current contract runs September through August. If awarded, would we keep that timeline? For a new project, we typically create a new contract representing the timeline there. So because it's not typically our process to award multi-year contracts, we do start fresh with new contracts. Emily or Shanna, would you like to expand upon that? No?
I shook my head. Sorry, maybe.
Okay, sorry. I've got so many screens up and active right now. I'm trying to pivot between them. Rachel asks, are funds directly distributed or on a reimbursement basis for all four sources of funding included in our spring 2025 RFP? They are directly distributed. You will have the option to complete an ACH or an automatic funds transfer form with our accounting department. And with the execution of your contract, you do get the balance of your award at the beginning of the project. We realize that a lot of this work is not able to start without the funding in place already. In different years, we have had different types of funding, including in the RFP. And so I do want to note that when we include early learning funds in our RFP, they do operate on a reimbursement process. But for these four funds, CHIP, SHARE, CPW, and CHW, THW funds, there is a one-time distribution. Shannon, great name. Would something like funds for interpreted services or bringing on a bilingual staff member to better provide services to our Spanish-speaking community be an allowable expense under these grants? I'm actually going to let Emily, Shanna, or Hope speak to that.
Yeah, so I'm gonna try to speak generally, because I don't know the specifics of what that application would be. Um, in general, it is complicated to provide a sustainability plan for a staff person. So I will put that up front, but paying for staff time to offer bilingual or interpretive services, as long as it's not a part of a covered benefit already. So, like bringing in an interpreter for primary care visits, that's something that is part of the Medicaid benefit and is a right, and would need to be supplied separately. But for a nonprofit like the SNAC program, that would not already be considered a covered benefit to offer those language services. So things like interpretation or translation, I at this point can't think of any of the funding streams that for which that would not fit within funding parameters.
Does that answer your question, Shannon? You can put it into the chat.
Yes, thank you.
All right, thank you. Adam Creighton asked, what is the cap on NICRA, LICRA overhead? So what is the cap basically on operational expenses? Emily has already responded in the chat. Thank you. From the RFP language, applicants are encouraged but not required to demonstrate a 25% match. Matching funds can be in kind, cash, or cash equivalent. Awarded entities may be asked to produce financial statements reviewed or audited by an external accounting firm upon request. If you have concerns about your agency's ability to provide a 25% match or limit your administrative costs, please contact our staff at funding@yamhillcco.org. And then please limit administrative expenses to 10% or below. We do encourage you to think about the sustainability and the impact of the awards being distributed in your community, which is why we consider those different categories. I would also add or just remind everybody that we do have the full RFP language that will be available on our website, and I believe we'll have a link to the language on the Found in Application site. We do want to make sure that you can both see all of the guidelines and all the recommendations before you're actively in the application process. And we have found that many of our partners will actually use that RFP, download it, work with it in a separate document, prepare those answers, and then when they are utilizing Foundant, they're simply copy and pasting into those different answers sections. So we want to make sure there are no surprises when you're actually in that application, in the application software. And we do include several details like what Emily shared. Did that answer your question, Adam? And if I ask you a direct question, you're welcome to chat back a response. I don't want to put anybody on the spot.
Yes, that answers my question, Shannon. Thank you.
Great, thank you. All right. Sonia writes, I'm with a Grange. We have a food pantry that both members and the community can access, and we hold veterans breakfast once a month. Would a request for funds to keep these programs going fit your mission? I do want to remind you, we're not able to discuss specific projects during this webinar, but we can answer this question by generally speaking to either capital funds or nutrition programs. We did cover that in the first half of the webinar. I don't know if you were able to join us, Sonia, but Emily or Shanna, is there anything you would add to this question?
I would just encourage people to really reach out for that technical assistance to ask some of these specific questions. Nutrition is identified as one of the priorities for many of our funding streams. And whether it's capital or more operational costs, those are generally also something that fits within our funding parameters.
Okay. Thank you, ladies. That's basically my question there. Thank you so much.
Oh, good. I'm glad we were helpful. Wendy asks, what percentage of a project can serve Washington County? Yamhill Community Care serves the entire population of Yamhill County and portions of Polk and Washington County. So within that, understanding what our service population is, a program could be located in Washington County and still qualify for full funding. So it doesn't have to include multiple regions. It just has to include one of our service regions. We have also had successful applicants who are headquartered outside of our service area, but serve our population. So for example, an organization in the Portland metro area has submitted a strong application in the past because they specifically were able to identify what populations in Yamhill County they were serving. So we're really looking to the impact to those 3 counties. All right. And Shanna, thank you so much for putting in the chat a link to past awards. Rachel asks, does portal application need to be completed in one session, or does Grant Lifecycle Manager allow you to save progress and return later? You will have an account where you can log in, you can pick up where you left off. You will not be allowed to submit an application that is not complete, where every section is filled out. So there's almost a safety net built into that process, but you do not need to do it in one setting. You can save and return to the application as many times as you need until 11:59 p.m. on Friday, April 11th, and then the application will close and you will no longer have access to it.
Wonderful. Thank you. It makes it easier to know what to expect without being on the platform before.
Yes.
I
One of the
would
reasons
just
why we chose to adopt the Founded software is we are aware that other foundations and funders across the state of Oregon used it. So that's why we mentioned this could be your first time using the software, or you may already have an account and be useful for it. In either situation, our team is here to support a positive experience with our RFP process. Emily, did I hear you start to mention something?
I was just going to repeat what you said earlier, that we always advise filling out some of the narrative in a separate document. As someone who has applied for a lot of grants, computers crash, things don't work the way you want them to. So that is always something we advise, but we have all tested the application section of Foundant, and I've found it to be very reliable. I can walk away for a long time and all my information is saved, even if I don't hit that button. And so far, it has been a really positive experience.
Adam echoes your sentiment in
Oh,
the chat. Says strongly encourage everyone to complete questions, answers offline. It does not reliably autosave, and it can log you out due to inactivity, losing your progress. I think sometimes grant writing has a reputation of being boring administrative work. I have found it to be a competitive sport. It does not matter if I have 6 months, 6 weeks, or 6 hours to get that grant submitted. It seems like there are always unexpected detours, delays, or surprises in the process. So we encourage you to set yourself up. It's huge adrenaline when you cross that finish line. All right. Any final questions? Shanna puts into the chat, in addition to our website, updates and information, including links, are posted on our social media sites often. I believe our most active channels are LinkedIn, Instagram, and Facebook. Right. Well, thank you again for the positive feedback. We will have all materials in English and Spanish posted on our website soon. We will use our conversation or question and answer period to create an updated FAQ, frequently asked questions document to go along with this. The RFP will be available. This recorded video will be available. We really appreciate you spending a time with us this morning. Even as the webinar was recorded, your live participation makes us better supporters, better stewards of this process, better communicators with your feedback and questions. I do want to encourage you to connect with us, funding@yamhillcco.org. Again, we cannot specifically advise for any project. However, we can support your application success. We can provide assistance with the application process. We can offer coaching or clarification on any of the scored categories for our applications or the strongest or expected outcomes for your application process. I again want to thank our staff. We had an amazing team. I joke these are expensive meetings, right? Thank you to Natalie, Patricia, Jennifer, Olivia, Danielle, Emily, Shanna, and Hope for all of the work they've put into this webinar, but also maturing our application process and distribution of funds. Have a lovely rest of your day. I think we can stop recording.